All right, folks, we're going to get started here. I'm going to apologize ahead of time because I have to do an ice-breaking warm-up thing here, and they're really bad dad jokes. Sorry. First, a quick introduction. I'm Bob Nutter. I'm the president and CEO here, and I'm going to warm up with a couple of jokes. So I've already asked a couple of docs not to hold this against me, but I'm going to try anyway. Did you hear the one about the germ? Never mind, I don't want to spread it around. That was bad. They get worse. They do get worse. But this is a nice one here. Why is a doctor always calm? Why is a doctor always calm? They have patience. Did you hear that? Do you know? You know. All right. I thought I heard it whispered over here. Big surprise. All right, one last one, and then we'll get started here. Who is the coolest doctor? Nobody? Think orthopedics? How about the hip doctor? All right, I tried. I'm done for the night. Hope you... Yeah, no, exactly. All right, well, welcome. Welcome to our 117th annual community meeting. We're glad you all could come here tonight. We've got a pretty exciting agenda for you to share with you some of the successes we've had in 2023 and also a little bit of looking ahead to 2024. So we're going to flip our thank yous on here first. So I always like to say thanks to folks because it's once a year we have an opportunity to have the whole community here to say thank you for all that you do to support this hospital. This is your community hospital, so we're here to try to make sure that we're meeting your healthcare needs now and into the future. So we really do appreciate you being here. We appreciate you participating in community health needs assessments and talking with us when we send information because that's how we learn and that's how we get better and can grow. I also want to say thank you to the Board of Trustees. We have several trustees here tonight, and I'd like to ask them to stand and be recognized, please. Sincere thank you to our folks that are on the trustees. We take so much advice and consultation from you on a regular basis, and we're grateful for all that leadership and that support you give to management all along. The executive team and our leadership team, there's several leaders in here and several members of the executive team. If I could ask you to stand as well, please. So many of these folks are the ones that actually are the ones getting a lot of the work done around here. So it's not one person, it's a whole fleet of people that do all the work around here. So I'm grateful for all their dedication and their commitment to this hospital. Looking at the auxiliary and volunteers, so we kind of push them both together on here too. So if I could look at a couple volunteers and auxiliary to stand up and be recognized as well, please. Again, thank you all for what you do. The auxiliary is responsible for nursing scholarships. They're responsible for so much of what we do today. They make the best cookies every holiday season too. And our volunteers, they're the first and oftentimes the last people to greet you when you come into the hospital. So that makes our routine is a patient's big event, and we know that. So we want to make sure that they can be greeted warmly and welcomed into the hospital. And our volunteers do a terrific job with that. This is also an opportunity, and Don would want me to make sure I say this. We're always looking for more volunteers. So if you have anyone if you're interested, we're always looking for more volunteers to help us. Our board is volunteers, but also we have a very robust group of volunteers that are here. That really is the grease that makes a lot of things work here. So grateful for all of the work that you give, including almost 9,000 hours of volunteer time to this hospital. And if you think about that, 9,000 hours of people committed to contributing to this hospital. We couldn't do it without you, so thank you very much for all that you do. And our staff. Our staff really is what makes everything work here. We work hard to make sure that we have the quality staff that this community deserves. We train them. We do as much as we can to make sure we have the absolute best and brightest people here. And it is our managers that make sure they can recruit the right people and train the folks to make sure that we're actually delivering the type of care that you want in this hospital. So I'm grateful for all of our staff to be here. And last, I'd like to recognize Jürgen and the food service team that's here. We're going to enjoy their product here in a little bit at the end of our remarks. But also, this room is our cafeteria, so we have to convert this over, and our EVS team does a terrific job of doing that. They move all the tables out, and then they have to clean up afterwards and move it all back in. So I'm grateful for all their help. This is something that they take a lot of pride in doing, and I think you'll see that when we get to the meal at the end of the ceremony. So today's agenda, as you'll see here, we're going to hear from Ashley Garrison, who's our vice chair of the board. Ashley's here because Jeff Woodward, who's our chair of the board, is actually coaching basketball. And he's actually coaching an undefeated team, and this was the last game of the season. And so it was a struggle, and he lost a coin flip with Ashley. So, so Ashley's here to give us our remarks. We also have Dr. Lucas here for remarks from as the president of the medical staff, and she'll have a nice discussion from the perspective of a physician and what that means to the physicians here. Fred Chisholm's going to be here. He's our treasurer, and he'll be giving some updates on our financials and so forth. Then we're going to jump over to Dr. Duffy right there, and he's going to talk a little bit about our quality issues and some of the other improvements that we've had with our new computer system, the Cerner system as well. And then we're going to finish up the operational speeches with Corinne Superchi, who's our Chief Operating Officer, to really dig into some of the operational improvements that have occurred over the last 12 months that we've had here. At the end of that, we'll have an auxiliary presentation by Claire May and George Mitchell, and they're the co-presidents of our auxiliary. And then I have a couple of comments to wrap up, and then we get to go and enjoy the meal. So with that, I'd like to first recognize Ashley to come on up and have a conversation. And I'll flip this right over. There you go.
Hi. Thank you all for coming tonight. It's great to see all of you here. First, I would like to thank the entire staff and community of LRH for doing an amazing job over the past year. We have a dedicated group of staff, physicians, nurses, other clinical employees, and volunteers that enable us to meet the healthcare needs of our region and be the leader in healthcare and employment in the North Country. We also have an engaged, supportive, and experienced board of trustees that represent a variety of backgrounds. They bring their unique skills and perspective to the board and subcommittees. These trustees volunteer their time and support LRH management in making major decisions for LRH. Thank you for your dedication to serving our community. I want to also acknowledge our longtime trustee, Elizabeth Coons. With the exception of Beth, who ended her tenure, our board remains the same for this fiscal year. On behalf of Jeff, myself, and the entire board, I want to thank her for her many years of service to LRH. As you can see here, our mission for the last 117 years has been the same, and tonight you will hear from speakers that will show you how we supported that mission in the 2023 fiscal year. One of the most significant initiatives was our strategic planning process to explore the possibility of affiliation with another healthcare system. Our goal throughout this process is to ensure continuity and expansion of care, allowing the residents of the North Country to receive a diverse range of high-quality healthcare close to home. The board-driven strategic planning began last winter. We are currently moving through a comprehensive, diligent, and thorough process, taking our time at every stage to be intentional and thorough in our decision-making. At the end of the day, every decision we make is about what is best for the healthcare needs of our community. We entered this process with a commitment to being as transparent as possible. We have shared updates with the community through several op-eds and kept our employees routinely updated through employee forums. This strategic process is a comprehensive, long-term project that requires extensive work, always keeping the needs of the community in mind while ensuring that LRH maintains its local identity. We will share updates as appropriate once we have news to share with you. All this to say that at the end of the day, our goal is to ensure that we fulfill our mission. We are focused on exploring options that align with our vision to provide exceptional patient care while growing to meet future community needs. We know that healthcare continues to change and evolve, and our mission is and will remain the same, focusing on the 3 pillars of healthcare: quality, access, and cost. Lastly, I would like to thank Bob and his executive team for their leadership. Because of everyone here, LRH continues to be the leading healthcare organization in the region. Thank you again for coming, and I now welcome Dr. Lucas, President of the Medical Staff. Podium.
Good evening, everyone, and thank you for coming tonight. Thank you for introducing me. I am Jennifer Lucas. I'm president of the medical staff, and I'm staff urologist. As a member of LRH's medical staff, I am also just one part of a very dedicated team of doctors, PAs, nurse anesthetists, nurse practitioners who are delighted to call the North Country home. Who are we in addition to that? Well, we're your friends, we're your neighbors, we're your coworkers, your ski buddies, your golfing partners. We share a passion for the art and the practice of medicine, and we know that this quirky and wonderful little community absolutely needs healthcare that is of excellent quality and full of compassion. Without that, we would not be able to live and work here safely. We can't do without it. And we also need it for our community to thrive. Since our goal is always to provide the quality of care that you would expect from a much larger city, we have an organized medical staff to ensure proper credentialing of all of our members and to maintain an excellent standard of care. Now that I've talked a little bit about who we are and what we do, I'd like to touch on some highlights of 2023. First of all, there's Cerner. The adventure that was Cerner for all of us in the trenches. Although most providers probably still would not describe it as an adventure like going on a family trip to Disneyland, on the upside, most of our tears have dried, and we have learned to work this system that in a way that works for us. Whoa. But the bottom line was we didn't have a choice. Our inpatient platform was going offline and we needed a new system. And we knew that a system that would be able to do inpatient and outpatient both would enhance our efficiency and make it easier for us to provide the quality of care that we need and strive to give. And so those goals have been met. Our outpatient and inpatient platforms are the same, and that is a critical goal in quality, and we were happy to be able to achieve that. Another very important thing we did in 2023 is we adopted new bylaws, and they are, I would consider them more modern bylaws. We kept the things we liked, such as we vote for our own leadership, and we have also extended the right to vote to our advanced practice professionals. And I think that was a very important step since they are so critical and helpful to us in providing the care that we do provide. We felt that it was right to give them that voice. And I think it's also important because it will make us more competitive as an employer in the region, which is also valuable. And so what I'd like to do next, and this is actually the most fun part, is talk to you a little bit about some of the very exciting and wonderful new people that we have managed to lure to the North Country. And I will not be able to be clear to discuss all of them, so these are just going to be highlights. In the emergency room, we have the fabulous Dr. Fox, who, when she is not suturing lacerations, is busy as an equestrian extraordinaire, so she's very talented. We have Erica Deckel and Sarah Maroon, who have provided us essential help in prime care, and I'm sure that Dr. McKenzie does not even have words to express his gratitude to them. We have Elizabeth Stewart, who is a nurse practitioner in psychiatry, which was a very critical need that we have had, so we are very happy to have her on our team. Sergio Ramirez Salazar grew up in Colombia before he came here to get his training, and is a delightful neurologist who loves the outdoors and is very busy with young children. And lastly, there is, well, not lastly, there's way more, but the last one I'm going to mention is Dr. Kristen Yu, who we're very excited to have on our team. She's going to be, well, she already is, working with Dr. Salerni in spine. She is an avid runner and mom of a 4 and 7-year-old boy, so she is wildly busy and running all the time, in fact. So we, as you can see, we are growing, and we're getting wonderful people to provide the care that, that we want to have here. Lastly, I would just say that, we are very, very happy to be here in the North Country, and we feel privileged to provide care to you and your families. And next, I want to bring up Fred Chisholm. Thank you.
Thank you.
Good evening. My name is Fred Chisholm, and I've been on the board since 2017. I served as the treasurer this past year and continue in that capacity in the current fiscal year. What I can say is that during my tenure, LRH has been strong financially, and we've been strong because we have a solid management and financial team that work together to help us arrive at prudent, responsible financial decisions to serve our community. One of those decisions was the investment in Cerner, our electronic health records platform, which Dr. Duffy will talk about in more detail than I will here, but it was a major undertaking for us, and we knew as a board that the undertaking of Cerner would be a major stressor for the organization, and so we decided to dial back the demand in the budget for 2023. Okay, and that's reflected in the slides that you see here. You can see almost all of the charts except for the emergency department, which you can't plan for because if you could plan for accidents, they wouldn't be accidents. But if you look at the other places where we could plan, you see the dip in 2023. We intentionally reduced the volumes to ensure that our staff had time not only to take care of you and take care of the rest of our community, but so that they also had time to learn the new system. As a result of the intentional slowdown, we saw patient visits down in both our practice areas, which you see on the slide, as well as outpatient services. But as you can see, as you look from left to right on all of the slides, we are anticipating a pretty strong year. 5 months into this year, we already are seeing signs of a strong fiscal year, and we expect by the end of the year to be right back at the volumes that we were at before the Cerner project began. Bottom line here is, even with the implementation of Cerner, we have remained strong. You see, if you look at the chart, that revenues have continued to grow. LRH has been able to rebound from COVID, and then as a result of our intentional slowdown, we experienced a small revenue dip last year from 225 to 217, roughly about a 4%, slightly less than 4% drop in revenues. But we knew that that was coming. We're hopeful for our future business with Cerner, and we're now recognizing more revenue. And what that allows us to do, having everything on a single platform, allows us to capture all the services that our community needs in one place, and to capture all of that billing in a single system so that we can effectively execute that billing more efficiently. So that's going to be one of the key values for us. Bottom line, as you look at these, as you look at our revenue growth chart, you can look at 2024 and see that we expect to be right back where we were pretty much before we began the Cerner implementation. And that's a credit to all the people behind the scenes who've actually had to do the work, learn the system, and keep the hospital running at the same time. So thank you to all of you who have been on the ground doing that. LRH has remained strong and steady with our staffing, and I'm pleased to be part of an organization that values its employees not just in word, but also in deed. And I want to thank all of you who've been involved in the work here this year for your work and your dedication to make this a place that people want to come to work at. It makes it so much easier on us as the board in supporting the work here when we have a premier institution in the North Country that people want to come to. So thank you. That's not just about hiring folks, that's also about the environment that you create for the people who are in the building. So thank you very much for that. While we had right-sized our staff to meet the pandemic, we quickly realized that LRH was a leader in both the COVID response and vaccination efforts. And one of our quick responses was to add to our workforce to meet the demand during COVID time. After COVID, the board made a decision to maintain our position as the marketplace leader in pay and benefits, which has been instrumental in helping us to maintain and retain a strong and well-qualified staff. As you may recall, and you see on the slide here on your right, my left, as you may recall, we had a high number of travelers during COVID. That's not our normal practice, but that was necessary in order to provide the level of service and the quality of care that we expect. And while we've reduced that by 32%, we continue to experience a tight labor market for healthcare staffing, just as all of the other healthcare companies do out there. What this means is that we still have travelers. And while we feel right now that we have too many, and that's not our usual practice, we have them because they're here in critical departments to make sure that we can maintain the level of care that you have come to expect and the level of care that we as the board expect us to provide consistent with our mission. We as a board need to and want to maintain access for our patients, so we spend the additional monies to ensure a high quality care was never compromised, even as we work through a major project like our conversion to Cerner. The last leg in our fiscal stool here is to talk about capital. With our mission as our top priority, the board makes capital investments back into the hospital on an annual basis. And last year, we approved $4.7 million of capital to be invested. Where did that capital go? Some of it went into infrastructure. Some of it went into our facility to maintain and upgrade this beautiful building where we now find ourselves. Some of it went into technology, both medical technology. We have a new lab equipment that there'll be tours of, and also into our IT infrastructure. The point of all of this is to help improve our operations, our safety, our responsiveness, and above all, our ability to deliver the high-quality health care that you count on from us. One of the key investments that we've worked through is the Cerner conversion. This new system, which will drive clinical efficiency and also improvements to both outcomes and safety, has been one of our major projects this year. I now ask Dr. Duffy to come up and speak to the move to Cerner and give you a little bit more of the detail. Thank you.
Thank you, Fred. Good evening, everyone. So I really want to talk to you tonight about the reason why we're here, our basic desire to deliver access to care and access to quality care. And we talk about quality a lot, but we'll get into that in a minute. But let's do us a little bit of business on the Cerner thing. I think you get the point. Everybody's talked about Cerner quite a bit. But just to put a fine point on it, these are the things that Cerner has allowed us to do. And it has to do with we're far more clinically efficient with improvement in outcomes and safety. There's no question about it at this point. We're over a year into it, and the outcomes are improved. We're integrated, so we have integrated communication among the treatment areas. We didn't have that before. We had 4 different treatment EHR platforms that didn't necessarily talk to one another, and you had to really kind of dig to find out what was going on. It comes to you passively now in this new single platform EHR. We now have enhanced decision support. So when the physician or the other providers go in and try to make a decision on ordering, Cerner will give you suggestions on things, and it will also tell you, be careful about this. This patient has that. Remember, it's a little bit of a nuisance sometimes, but it's very valuable. And you can just flitter them away, you toss them aside if you want to, but sometimes they make a difference. And Cerner has very, very enhanced decision support. So that's very valuable, and it adds to a level of safety as well. And the improved communication with the care team, that goes hand in hand with being a single platform. We can now, we now have increased collaboration. We have collaboration with outside partners, but it's easier to collaborate now because the information that comes out of our platform can be shared and is shared almost automatically with anyone else. Not anyone that just wants to on a whim, but if you go there as a patient, they have access to your information here at LRH, and it's a two-way street. We can get information from DH, Concord, Elliott, et cetera, quite easily, whereas in the past, it was fax machines and who knows what else, long telephone calls and wait for information. It comes quite quickly now. Information capture, you can get more stuff in it. So your medical record is more true, and it has more information for the next caregiver to use. And there's a more accurate inventory of services rendered and related charges for charge capture. You got to pay the bills. I mean, you have to, when you're going to do stuff, you're going to use up a supply, you want that thing to be automatically accounted for so that the next time somebody needs something, we have it. We have it in stock. And, you know, I think really importantly also is our patient portal. It's extremely functional. I'll talk about that in a minute. So let's go to the next one. So, you know, all good in that regard. That's the setup. The thing is a great platform. It's used in many, many large medical centers. We use a Virgin for small hospitals, but it has everything that we need that the big medical centers have, and it has all that connectivity functionality that I mentioned. But, you know, it's hard to do this kind of thing. It's almost like trying to move the earth sometimes to get these things implemented correctly. So, you know, there's some issues with the build, issues with how it was installed, issues with how we see it and how we use it in patient flow. And we're going to have to optimize the thing. First of all, we're going to definitely go forward, and we have already started, with optimizing some revenue cycle functions. Revenue cycle is that thing that we, in healthcare, we call it revenue cycle, that has to do with seeing a patient, getting information, putting the charge down, making a bill and getting a bill out accurately, collecting the money, and then taking the money and putting it towards helping other patients or continued care. That's revenue cycle. That needs to be optimized so it's more efficient. We don't miss something, it comes in, the money comes in, and you get more accurate and timely billing. How's that sound? I mean, you know, this is not the only place in the universe where bills kind of stink, right? It's pretty universal. A lot of places with these new platforms, Epic and Cerner, have pretty much solved that. And this is going to get us there. We're not quite there yet because, you know, you install the thing and there's bugs in it. We've got to get those bugs out. We're using a group called Nordic Consulting Company, who actually is used by Cerner itself to optimize builds and EHRs in particular places. And we've been engaged with Nordic now for a few months, and they've done a fabulous job. We're doing 6 implementation or optimization phases with Nordic, the Nordic group. We're on the second one. This is actually called phase 1 because phase 0 was their assessment. So we're doing those, and we're on the second one already. So we're going to continue to do that, and we're actually collaborating with Cerner on that, and they're on board with us doing so. We think all of this in the long term will decrease our IT costs. We don't keep this platform on premise. The old ones, or most of the old ones, sat in a closet upstairs that has special environment and special fire suppression systems and all kinds of things, and creates heat and uses energy, and it's got a lot of moving parts. We can decrease all that now because our EHR, which is our biggest piece of software and our biggest IT item, doesn't sit here anymore. It sits in Kansas City in a beautiful big old building that we've visited that's protected from everything in the world. Oh, and there's another one too, about 400 miles away that looks just like that. So that's where that all is. We don't have to deal with that. So we can decrease our IT costs in the sense that we don't need to support that, and we have less functional servers, frankly. The cloud is where the stuff is now. So we're going to definitely decrease costs. Just a bit about the portal. It's called Cerner Healthy Life. It gives you access to your personal information. I think it's pretty good, frankly. You can communicate with your healthcare team. It's two-way communication. You not only get information, you can send information in. You can look at your lab imaging results and other test results. You get those results the same exact time the physician or the provider does, exactly the same time. So there's some stuff with that where you may get it before the provider knows. If they're in surgery right now, they hadn't seen your results yet, but they'll get to you and you'll be able to have a conversation at your leisure as soon as you want to. So you get that in real time. You can look at your visit summaries, discharge instructions. You can request and cancel appointments. No need to wait on the telephone. We all know how difficult the telephone can be in all industries to try to connect with people. And you can do prescription refills, pay bills online accurately. And now we have up to 6,000 active users, so we expect that number to jump quite a bit over the next couple of years. So, LRH is a long history, 117 years. Modern medicine, since World War II, has really been obsessed with trying to get the right medical care to people. This place is no exception and has a long history. I've been here 3 decades. John's here for 4. There's a long history of having really good physicians here and other individuals, including great nursing staffs over the years, to deliver care. It matters to us that it has to be good. It has to be accessible, it has to be good, it has to be meaningful. In the world of quality, the academic world of what is quality, there's PhDs running around talking about what is quality. Well, we come up with a bunch of things that define what quality care is in medicine. First of all, it has to be safe. If it's not safe, it's not quality. It has to be timely. It has to be when you need it. If it's not when you need it, it's not quality. It has to be patient-centered. The patient has to be at the center of the whole thing. What the patient needs, sometimes what the patient wants, not always, but always what the patient needs. It has to be equitable, equally for all. It doesn't mean we dummy down the care for some people to make it the same. It means that everybody should get the highest level of care that's possible. But really the definition, so it has to be all those things. But quality care is the increased likelihood of desired outcomes. So it has to be effective. Effectiveness means you get the desired outcome. We all have expectations of what our outcome is going to be for our care. When you get that, it's effective, and that's the other tenet of quality care. Now, we're all biological systems, and we say, I got to give you the biological system talk, Don, that we're all biological systems, and the reason why it says increased likelihood is because we're not mechanical beings. We're not computers or car engines. You fix something, it should work. Or if it's not, you replace the part and it'll work. You can rebuild any engine. With people and all other biological systems, vets have the same issue. You can do everything right and it won't come out correctly. So they had to put that in there, increased likelihood of desired health outcomes. I really emphasize that because I think that's important for everybody to understand about the difference in healthcare and in delivering widgets to people. It's patient-centered and it's variable. So, answering the quality imperative, it's imperative that we have quality. You go to any healthcare organization in the entire universe, and people talk quality. Oh, we've got quality, this one's got quality, we've got quality. What have we done about quality here? Well, first of all, we're driven to serve the community. That's why we're here. There's no reason for this building or this organization to have existed if it doesn't serve the community. It sure doesn't serve the doctors, doesn't serve the nurses. They're all here to help people, and the organization is built up around it to make that happen. We think, and this is the board, this comes from our board of trustees. This is not a management imperative. It's from the board, and it has been through successive boards for many, many, many years. We believe that this area deserves the same level of quality care as in more populated areas. Why shouldn't you get the same care in your hometown that you would get in Manchester, or Burlington, Vermont, or Portland, Maine, or Boston, Massachusetts, or Lebanon, for that matter? We strive to get you that. Now, you realize immediately that there's problems with that, but we're striving, and we're trying to get you that. So therefore, we provide many essential services most hospitals this size have cut. Women's health. Absolutely, a society needs good women's health. Try to have an economically vibrant area without women's health. Young people don't want to stay here. Young people don't move here to take jobs. You can't grow the economy. Absolutely, this board has been adamant that we will continue to deliver women's health in obstetrics specifically. Critical care. Okay, most places have an ICU where they take care of sicker people than they would on their regular floor. But we have actually kept the critical care mantra, the thoughts that we're doing critical care here. Our ICUs are fitted out with the best equipment. We have doctors and nurses specially trained that do critical care medicine. We are wired in to DH during the day, Dartmouth Health during the day, so that their critical care doctors can talk to the people who take care of our critical care patients, and they put a plan of care together. Those Dartmouth doctors can actually get in the medical record and order things, monitor things, watch things, and there are nurses at DH that do that too. At night, we have someone else, it happens to be Mayo Clinic most of the time, that do it at night. So we have partners that we work with to absolutely deliver you critical care. Ventilator management here, it happens. It doesn't happen usually at a hospital this size. We also have a wide array of surgical subspecialties. Complicated sinus surgery, urology. We have 2 neurosurgeons who do neurospine. Back pain is a big deal in rural areas, and we can take care of many of those cases here at home. We have a number of other surgical subspecialties, including, as you all know, orthopedics. You can get your hip replaced here, your knee replaced here, and it's not the second or third one they're doing this year. We do 400 a year. We have a specialist that does hip and knee replacement surgery. That's what he does. We have other fine orthopedists who do things like total shoulders, shoulder repairs, not really seen in a small hospital. We think all this is important to get to the place where we talk about giving you the same care as in more populated areas. Access is important. We have to have the people and the programs to have the access be meaningful. We believe we should operate with a team approach to medical care. I don't know about you, John, but when I graduated in the early 80s, it wasn't really a team sport. But we knew it should have been right from the start, and it is now, and we make sure it is here. There's an entire team watching out for you, and we collaborate and communicate. Our physicians, every one of them is highly qualified, and they operate with the highest qualifications, meaning they're board certified or fellowship trained to boot on top of it in the specialty they're practicing in, not in another specialty, and they're just decided to do something else. Our radiologist has the highest qualifications and certain extra certificates and extra fellowship training and training in advanced imaging and MR and CT scan. You don't see that in a small hospital. But the whole team is held to the highest standards. The nurses have their standards. They actively and enthusiastically keep them up and agree with us that they're necessary. An example is that we have gone through a 2-year process now to have the American College of Surgeons designate this hospital as a trauma center. That doesn't mean we're going to be, we're not going to be Mass General or anything like that. There's levels of trauma centers. But we're going to be as designated as high as Catholic Medical Center, Exeter Hospital, Wentworth Douglas Hospital, in the state of New Hampshire. And we're going to be able to take care of those patients, working with our partners at Dartmouth and Concord and Elliott to get them delivered when we need to say goodbye to them and send them on even to a higher level of care. That's a very stringent, it's taken 2 years and we're still not there. It's a very stringent process. Evidence of, I put it up here as evidence that we strive to do everything we possibly can to be the best. And, we're determined to continue to add services to get back to the same quality care and access as more populated areas. So we're going to maintain the current services, right? We'll continue with region-leading efficiency of care. We are the most efficient hospital in care, efficiency of care in the region. That means something. That means that not a lot of time, effort, money is wasted, and the talent is utilized. This is a metric that the finance people can look at, and that the quality people can look at and actually measure. We can collaborate with partners also on our current services to help with the quality, access, and cost. Keep the cost as reasonably as possible, give you the highest quality as possible. But we can also expand services, and we're going to have to expand some services, we believe, in order to maintain that high standard of giving you the same care as in more populated areas. We can do it in-house. We've done a couple of things in-house. We can align with quality partners, and all to keep patients close to home. So that's basically what I had tonight. The last slide really talks about sustainability. It's all well and good to do this, and I can tell you personally, it was a lot easier to do the quality things that we used to do back in 1990. It was cheaper, there was more talent. It's getting harder and harder and harder and harder because medicine is becoming more complicated, needs more gadgets, it needs more computers, it needs more things to be up to date and to do the best way. You're not just up to date to be in fashion, you're up to date because those ways are better. Sustainability is important, and there's concern for sustainability. I will say this, the board, I've watched over the decades, has always been behind how are we going to keep this going, and we have to do the best. So with that, I'll throw it over to Corinne, who's going to tell you a little bit of details about some of the operations and services and programs we have here currently. Thanks.
Good evening. Thank you for being here this evening and allowing us the opportunity to share with you what we've been working on in the last 12 months and what we're focused on in the years ahead of us. We've talked a lot about quality. Along with quality is our commitment. First and foremost, we have a huge commitment to your healthcare needs. That's why we're here. Without our community needing healthcare, we don't exist. How do we do that? Every couple of years, we do a community health needs assessment where we ask the community, what services do you need? What's lacking? What do we need more of? What do we have plenty of? How do we adjust to meet the changing patient population and community that we serve? We then take that community health needs assessment and sit down and determine how do we meet those needs? How do we expand current services to meet that need? How do we add new services? Some of the expanded and enhanced services that we've done over the last 12 months are our tele-emergency program for transfer coordination. We want to provide as much care as we can close to home for our community, but there are some things that we can't do for you here. If you need open heart surgery, you need to go somewhere else. We know our limitations and we focus on quality. So having our tele-emergency program, that gets us connected to help our physicians coordinate with getting you to the next care location that your illness situation requires. We added collaborative psychiatry, huge need. Probably for the last 10 years, it's been a consistent theme on our community health needs assessment that we need more mental health, behavioral health services for patients in our community. I think that has absolutely grown even more since the pandemic. And we've responded to that. We launched a collaborative psychiatry program where we've expanded access to behavioral health for our patients. They can see a nurse practitioner who specializes in behavioral health. They can also see a licensed independent clinical social worker, and all while collaborating with a psychiatrist. And they coordinate the care so that patients who need behavioral health, mental health services can get that, and they can get that here in their community. Neurology, we expanded our neurology program. We added a second neurologist. Dr. Lucas mentioned Dr. Salazar. For a hospital our size, to have 2 neurologists is very impressive. He's been a great addition to support the fabulous neurology services we've had from Dr. Umashankar for many years. And he specializes in behavioral neurology, specifically Alzheimer's and dementia, which is also an area that has been identified on our community needs assessment as something that we need more services for our community. Spine surgery. We added a spine program just before the pandemic, back in 2019. And we, in November, Dr. Salerni did our 500th spine surgery here. And we're probably well over 600 by this point. This year, in addition to Dr. Salerni, we added Dr. Yu, so we're doing spine surgery 2 days a week. That is 600 patients that previously would have to leave their community to get that service. And for many patients, spine surgery is life-changing, living with chronic pain. And we have learned that people in our community will make medical decisions based on geography and their willingness to travel for services, which again is why we're so focused on bringing services to our community. We should have the same quality. We deserve that same access. Coming soon, before the end of our current fiscal year, we'll be adding dialysis in our intensive care unit so that patients who are critically ill and need dialysis either short-term, or maybe they're going to miss a dialysis appointment because they're hospitalized, can get that service here in their home hospital. Previously, those patients would be transferred to another facility, likely Dartmouth, Concord, Elliott. We'll be the first hospital in the North Country to offer this service for our critically ill patients. How do we do all of this? We collaborate with quality partners. We can't do it alone. We can't be everything to everyone, so we partner. Some of our long-standing partners, Ammonoosuc Community Health Services, Dartmouth Health, Midstate, and the University of Vermont, who we use for our pathology and lab services. We've made a commitment to our hospital as well. Fred mentioned the $4.7 million of capital expenditure that happened last year. These are some of those items where that money went, all with a focus on care quality. Cerner, you've heard about Cerner enough tonight, so you get the gist. We put just under $500,000 into our Omnicell medication dispensing cabinets to upgrade them. They're in all of the care areas on the hospital side to keep medications secure, added in additional safety and security around controlled substances. Also allows us to profile medications to meet national patient safety goals around medication administration. We're the first hospital in New Hampshire to install a secure prescription locker. So if you've been in our lobby, you've seen that. That allows increased access to patients to utilize our retail pharmacy and our employees. Our retail pharmacy is open 5 days a week, but their hours don't always work for people. So you can have your prescription sent to this secure locker, similar to lockers that you might have used at Lowe's or Home Depot to pick up supplies. You can come and get your prescription at a time that's convenient for you. We made a couple of major investments in our diagnostic imaging area that absolutely impact the quality of care that our patients receive. We upgraded our nuclear medicine camera in July. huge undertaking. What that means is better quality imaging. When physicians order nuclear medicine studies, the physicians that are ordering that will have better imaging to be able to make decisions about next step of care for patients. We also upgraded our MRI software to do two things. One, improve the image quality, because again, if the physician, the provider has the best image possible, they can make the best diagnosis of what's going on for the patient. And it also decreases the amount of exam time. So if you've ever had an MRI, having to lay in that MRI machine for 45 minutes to an hour, depending on the number of exams, it's a long time. So by upgrading that software, we've decreased the amount of time that you have to lay perfectly still in that very loud machine. We've started phase 1 of our nurse call system, which will have additional capabilities built within it for the patient to communicate with members of their care team. We also mobilized an entirely new IV pump fleet for all of the areas in the hospital where IV pumps are utilized. It's connected to a drug library so that it aids in ensuring accurate rates and doses of medications, particularly in those critical care areas like our emergency department and our ICU. We've done a lot to continue to modernize our facility. We have a beautiful facility. We have been in this building for 23 years, but it's time, just like home. It's constant updates. This year, we updated all of our lighting to LED. Improves the look of the facility, but also decreases the energy use, and we're already seeing the gains in that area. We were the first hospital in New Hampshire to add a sinus navigation system that allows Dr. Fitzpatrick to do minimally invasive spine surgery for patients. What that means is, it's minimally invasive, so it's less complicated, better recovery for patients, and allows him to really provide top-notch, high-quality care. And then our lab automation system, we're extremely proud and thankful for the support of our board to put in a lab automation system. We are the first critical access hospital in the country to have this system. Not in the state, but in the country to have this lab automation system. It will change how our lab does their business. It will decrease turnaround times. What does that mean? When you're in the emergency department and your physician or PA or nurse practitioner is trying to determine whether you're having a heart attack, they're going to get quicker turnaround time of your labs to say, yes, they're having a heart attack, or no, they're not having a heart attack. It will dramatically improve the quality of care. Additionally, it will allow us to take on more volume and add additional testing that previously we were sending out to other reference labs. It may also, as we're in week 3, decrease the amount of staff that we need in the lab. We're trying to be proactive and understanding less people are going into the laboratory sciences field, so we need to be creative in how we're going to continue to operate our lab. It may also will offer us at some point the ability to take on labs for other facilities if they desired, without impacting our staffing at all. And then most importantly, commitment to our people. We have focused a ton on our staff. They are our most valued resource. Without all of them, the rest of it doesn't happen. Yes, we need patients, but we need arms and legs and people who genuinely care about taking care of other people. Taking care of complete strangers is not easy. It's a calling, and we have the best staff here. We've put a lot of programs in place this year to really focus on our staff and recognize them. We launched a national program called the DAISY Award that recognizes nursing staff. And then we did a spin-off of a B Award that recognizes non-nursing clinical staff. And what makes these two awards really special is that it's not management or peers who decide that the employee deserves this recognition, but it's our patients It's the patient's family members. They submit nominations. We get dozens of them every single month, and they're very emotional. When you read some of them, they're very heartfelt, and it is extremely clear the impact that our staff are making on the patients they take care of. Continuing to invest in our staff, we've launched a couple of Grow Your Own programs. One, it's a way for us to ensure that we have staff in areas like medical assistant program and our surgical scrub tech. But it's also a way for us to ensure that the staff can grow, that they have a path to the next career step for them. Our medical assistant program has been hugely successful. In January, we had 11 Grow Your Own medical assistants pass their national certification exam. They spent countless hours doing clinical work in our clinics. And then they also did a lot of simulation, hands-on skills training, and obviously didactic online education. In 2023, we were able to get back to our employee service recognition event. Through COVID, we were unable to do that. It's always a highlight of our year to be able to take the time to recognize our employees' service milestones. We have employees that have been with the organization that we recognized in 2023 for 30, 35, 40, and 45 years. That's unheard of. And every year, we continue to have people who are hitting those milestones, and that's a true testament to their commitment to our community. And we were able to bring back some of our regular employee celebration events. If you're on our social media at all or our Constant Contact, you're seeing some of those things that we've tried to bring back into the workplace to help celebrate and allow the staff to celebrate milestones, like we just had Super Bowl party last week. And finally, compensation and benefits. Without the support of our board, and Fred mentioned market leading, the board has charged administration with ensuring that we are market leading in pay and benefits. They firmly believe we need to take care of our staff. If our staff are taken care of, they will take great care of our patients. So through their support, we are proud to say we absolutely have market-leading benefits. They're unheard of. As we've seen employees move here from other areas, they're blown away by our benefit program and our compensation. And now I am going to turn the mic over to Claire May, who is one of the co-presidents of our auxiliary.
Hello. First thing, we'd like to say thank you to LRH for their continuing service and support of this community and the region. The excellence in patient care is an example of what a group of dedicated people can do when they work together. The auxiliary is very happy to be a part of that. We're also thankful for the opportunity to have Moose Ledge Gift Shop in the mix. We're proud to offer this service to LRH, staff, and community. It's the auxiliary's biggest fundraiser.
And because of this, in 2023, we continued funding the Born to Read and Reach Out and Read programs, providing a book to every child born at LRH and every child attending key pediatric milestone appointments at North Country Primary Care. We also supplied sweatshirts, pants, and shorts to patients needing replacement clothing. The auxiliary matched the $1,835 raised by the Nursing Professional Practice Committee for their Dinner at the Doorway campaign, supporting an underserved population in the community. We are proud to have supported mothers by contributing $10,000 to the establishment of the new lactation pod. Finally, last year, we awarded $18,000 in scholarships to current staff members continuing their education and local graduating seniors pursuing degrees in medical programs.
We've also offered some events to the LRH community. We do Santa on Christmas Eve, and it's so much fun to watch the patients when Santa arrives in their room and to see how they light up is just thrilling. We've done the Christmas cookie sale. We've also decorated the hospital for Christmas. We do a basket raffle. We do a couple of special recognition days. One is Doctor's Day, Nurses Day, and then we do an Employee Sunday Day.
In closing, we want to extend our deepest gratitude to our current auxiliary members. Their unwavering dedication and selfless contribution of time to our events and fundraisers are the backbone of our organization. Without their invaluable support, we wouldn't have these successful events or be able to make the impactful donations. As we move forward, we are actively seeking new members. Whether you're here tonight as a staff member, a spouse, friend, or community member, we invite you to join us at our monthly meetings held every second Thursday of the month. A passion for helping others is all that's required. So thank you so much for letting the auxiliary continue to be an important part of this hospital. And back to you, Bob.
And thank you, guys. I mean, it's amazing work that you've just heard from our auxiliary that they do. It really is amazing. But if you think back about what you've heard this evening, the amount of work, the amount of improvements, the amount of growth that this hospital has done is really quite amazing. So it's not without support of this community and our board that we're able to make these things happen. So we're incredibly thankful for you. We have a special presentation, but I want to go over a couple of recaps rather than going into a long speech here, because you've heard from both Corinne and Ed a lot about the stuff that we do on the inside, and you've heard from our trustees about a lot of things that they do from a governance standpoint, and you heard from Dr. Lucas about the engagement that we have with our medical staff. That stuff is all incredibly important to make sure we balance this whole thing else. One person can't do this. The whole community can't do this without everybody coming together with one focus on that mission. So we're incredibly grateful for that. But just think about some of the things that we heard tonight. And I appreciate both Dr. Duffy and Corinne kind of bringing these things up. But I heard them say we're no longer able to operate in silos anymore. We have to look for meaningful collaborations. And we are always looking for those meaningful collaborations. And you saw and heard some of those things that we're currently working on and some of the things we're working on in the future. We heard a lot about how much pride, and you probably hear that in their voices, that we have with our physicians and our staff and our mid-levels that we have here, the nurse practitioners, the physician assistants. It's incredibly important how skilled these people are, how dedicated they are to your health. These people work tirelessly. And we are short-staffed. Everyone knows healthcare is short-staffed. There's not enough folks out there. And we fight that every single day. We wish we could snap our fingers and get MAs in here to help, and we could get other support in here, and nurses and other doctors, but we simply will not stop trying until we get these positions filled. So we're very, very proud of our doctors and our staff that we have here, and we truly believe we have the best folks available, not in this region, but available. We work really hard to get the best people here. Board certified and fellowship trained docs, they are really difficult to get, even in an urban area, and we're able to actually attract them here. And again, it comes down to our board enforcing that and insisting that we have the top quality people that we have here. You also heard us say, where you choose to live should not impact or limit the quality of care that you get. So our board, again, wants to make sure that we're making those investments in tools like we did with Dr. Fitzpatrick on the sinus navigation system, because that is an incredibly important thing to improve the quality of the service that you might need. Now, maybe those things that we talked about today are not on your I need that done list, but for other people they are. And so that's a really important piece that we need to always keep focus on there. So what I'm going to do now, I'm going to skip ahead a little bit here. And why don't I have Ashley come on up for a recognition. We have a special member of our community that I would like to recognize. Oh yeah, you're going to read that, right? Right, yes. So, Dr. Sauter, if we could have you come up. Is absolutely no, I don't have the mic here. It's no surprised that you've made a lasting impact in this region, but you've had a lasting impact even beyond that, and we're grateful for that. We actually have a letter from the governor that we would like to, Ashley would like to read for everyone to know.
Dear Dr. Sauter, it is my honor to recognize you for 45 years of unwavering commitment to serving the healthcare needs of New Hampshire's North Country region. It is evident by your valuable contributions to the field of medicine that you are indeed a champion and advocate for rural health and the communities you have served over the last several decades. You have made a lasting impact that will resonate for decades to come. You are a shining example of what compassionate, patient-centered healthcare looks and feels like, touching the lives of multiple generations and bringing thousands of babies into the world. Your accolades throughout your career come as no surprise and attest to not only the doctor you are, but also the person. The honor of becoming the namesake of LRH's Labor and Delivery Suite, recipient of the Littleton Area Chamber of Commerce's Citizen of the Year Award, being named one of the best doctors in America for women in national polls, and the countless leadership positions you have held or initiatives you have spearheaded, to name a few of your distinguished achievements. I am grateful for your many years of service and extend my very best wishes as you embark on this next chapter of your life, a well-deserved retirement. Thank you for paving the way for the current and future generations of providers in obstetrics and gynecology and healthcare as a whole. Your personal and professional contributions have left an indelible mark on Littleton Regional Healthcare, the Littleton community, and the greater North Country. Please accept my sincerest thanks for your lifelong dedication to your admirable work and service to your community. I hope that your retirement will afford you time for the great outdoors and most of all, your friends and family. Sincerely, Governor Christopher Sununu.
Thank you. Really appreciate it. An incredibly humble guy, Dr. Sauter, thank you for everything that you've done for this region, this community, and even the governor wants to thank you. So I think it's wonderful. So we're now between us and the celebration we have over there. I'm sure if you want to reach out to Dr. Sauter yourself and thank him and congratulate him for his retirement, you'll find him at the sweets table right over there, because Dr. Sauter has a sweet tooth and I'm very close by with him on that one. So thank you all for coming tonight. Please go to the conference rooms right outside here and we'll enjoy a nice little food and reception that we have for you. Thanks for coming.